Some of the best supplements for hair growth also have the potential to trigger hair loss if they are used incorrectly. There's this idea that people with hair loss get that if something that they were taking worked well, that more of that same thing will probably work even better. This can take people to taking higher and higher doses of certain ingredients, which may work well at lower doses, but which may start to trigger hair loss when they reach a certain threshold. Let's make sure that doesn't happen to you by talking about how much you should be taking of these certain hair supplements and how to avoid taking too much so you don't trigger hair loss. We're going to be talking about 5 different supplements that can trigger hair loss if they're used incorrectly, starting right now. Number 1, we have creatine. Don't freak out because I just did a video explaining why creatine doesn't cause hair loss, which is why I'm including it here right now. There's a common misconception that taking creatine will trigger hair loss, but that's not entirely true. What is true is that some of the activities that people also tend to use in conjunction with creatine may contribute to hair loss. And that's because many people using creatine also combine it with weight loss resistance, and weight loss resistance has the capacity to increase androgens or testosterone. Anything that increases testosterone or DHT has the potential to trigger hair loss in certain genetically susceptible individuals. But it's not the creatine causing the problem, it's the activities associated with the use of creatine. But we need to put this into context. Even though the existing evidence out there does not suggest that creatine causes hair loss, there are still anecdotal reports that it can. So if you are somebody who is really concerned with hair loss, then you might want to consider skipping out on using this supplement. But that's only true if you have a specific type of hair loss or you're at risk for a specific type of hair loss called androgenetic alopecia. This is the type of hair loss that causes male pattern baldness and can occur in both men and women. And if you have this specific type of hair loss or it runs in your family, then maybe it is best to avoid using creatine just based off these anecdotal reports. But otherwise, don't stress about using it even if you have other types of hair loss such as telogen effluvium or alopecia areata. The second supplement that can trigger hair loss is excessive use of selenium. Selenium is a super important trace mineral that your body uses to protect itself from oxidative stress. And selenium deficiency ultimately leads to thyroid dysfunction, cellular inflammation, and hair loss. The specific type of hair loss associated with selenium deficiency is telogen effluvium, which is diffuse hair loss across the entire body. This occurs because if your cells don't have enough selenium, they're unable to protect themselves and they ultimately end up dying, and this impacts the hair follicle and ultimately causes hair loss. For this reason, plenty of people, especially those with thyroid problems, supplement with selenium to try and improve their hair growth. And while this strategy does work for a lot of people, it's easy to accidentally take too much. That's because selenium dosing needs to be inside of a Goldilocks range. If you don't take enough, you won't experience any benefit, and conversely, if you take too much, you may experience the signs of selenium toxicity. And one of the symptoms of selenium toxicity is hair loss. And unfortunately, it's a lot easier than you think to accidentally take more selenium than you need. The RDA for selenium is set at 55 micrograms per day, but you can start getting into trouble and toxicity when you start taking doses as high as 200 micrograms per day. And that's really only 4 times the RDA, which is not that much. There are a lot of people out there who are taking doses as high as 400 micrograms per day or even higher. For optimal hair growth potential, your dose of selenium should not exceed 100 micrograms per day unless you have a thyroid problem or unless you're treating something like an autoimmune disease. And by the way, this problem with excessive selenium intake also applies to food. The number one highest food source of selenium is Brazil nuts, which contain anywhere between 6 micrograms and 154 micrograms per nut. This means that eating 2 to 4 nuts per day has the potential to put you over that safety threshold. If you have hair loss and you're trying to fix it with selenium, make sure you look at your dose to see if you're accidentally taking too much. Next on the list is taking excess biotin. Again, notice I said excess here because we're not talking about normal daily intake of biotin. We're talking about taking way more than you need, which when it comes to biotin containing supplements is actually really to do because standard dosing often contain multiple times the RDA. If you are somebody who is suffering from hair loss, then there's a very high probability that you've already heard about biotin. Biotin, otherwise known as vitamin B7, is one of the most popular hair regrowth ingredients out there. There's a lot of conflicting evidence as to whether or not biotin truly helps with hair loss, but let's put that argument aside for just a minute. The reality is there are a lot of people out there suffering from hair loss who are using biotin to try and treat the problem. So whether or not it works is less important than what happens when you take it. And there are some anecdotal reports that taking excess biotin can trigger hair loss. I'm not convinced that excess biotin intake is a primary driver of hair loss, but I do think it's plausible that it may trigger hair loss in certain susceptible individuals. But in order for biotin to trigger hair loss, you would have to be taking massive doses for a long period of time. And for most people, this probably isn't an issue because biotin is a B vitamin and these are water-soluble vitamins, which means your body shouldn't have any problem eliminating any excess through the urine. Having said that, we do see some people who experience toxicity using B vitamins like vitamin B6, which is also water-soluble, so it's plausible that some people might also negatively react to vitamin B7 in a similar way. If you were trying to identify whether biotin was triggering your hair loss, you can look for a couple other signs and symptoms. Other signs of excess biotin intake would include things like acne, diarrhea, and nausea in addition to the hair loss. In other words, you wouldn't just experience hair loss alone, it would be combined with other symptoms. If you haven't seen any improvement in your hair loss while taking a biotin supplement, it might be time to reevaluate your dose. Next, we have excess vitamin A. Unlike the B vitamins, vitamin A is a fat-soluble vitamin, which means it's much easier for it to build up inside of your system and reach toxic levels. Many people already know that vitamin A is necessary for healthy hair and skin, which is why people with hair loss start supplementing with it. And unfortunately, those same people don't realize that taking too much of it can actually cause the problem they're trying to treat. Vitamin A toxicity is well documented and causes a whole host of symptoms, one of which is hair loss. Toxic symptoms start with nausea, vomiting, and a headache, and continually progress if you take more and more until they may trigger alopecia. Having said all of this, you really don't usually need to worry about vitamin A toxicity unless you are taking a really high dose of an isolated vitamin A supplement. The dosing that you would find in a multivitamin or in a regular hair regrowth supplement is usually not high enough to get you to this toxic threshold. For perspective, you would need to take 10,000 IUs of vitamin A every single day for months to even years to even approach this toxic level. Toxic levels can be reached in weeks to months instead of months to years if you are using an even higher dose than 10,000 IUs, or if you are using a water-soluble formulation of vitamin A. You should also be aware that vitamin D protects against vitamin A toxicity. So if you are taking something like a vitamin ADK supplement, you are protected. These ADK supplements contain vitamin A, vitamin D, and vitamin K, usually as vitamin K2, which protects against the toxicity of high doses of vitamin A. And when it comes to foods, you should also be aware that liver contains the highest concentration of vitamin A out of any other food. This is because vitamin A is stored in the liver. So if you eat a lot of liver, you're getting a lot of vitamin A. Liver is definitely one of the most nutrient-dense foods on the entire planet, and I'm not saying it's unhealthy by any stretch of the imagination. I'm just letting you know, hey, it contains a lot of vitamin A. This is important if you are somebody who is also taking a high-dose vitamin A supplement. If you are somebody who likes to eat a lot of liver and who is also taking another high-dose vitamin A supplement, then you are putting yourself at risk for toxicity more than the average person. Just like selenium, taking some vitamin A is great for your hair, but just make sure you're not taking too much. Number 5, we have excess vitamin E. One of the primary drivers of hair loss is inflammation inside of the hair follicles, which is why one of the best shotgun approaches for treating hair loss, if you don't know what's causing it, is to use supplements which reduce inflammation and oxidative stress inside of the entire body. And vitamin E does just that. There are 2 forms of vitamin E that you should be aware of. The first form is tocotrienols, and the second form is tocopherols. They are most well known for their antioxidative capacity, which means they can protect your cells if taken. Just like vitamin A, vitamin E is considered a fat-soluble vitamin, which means you don't necessarily have to take it every single day because your body has a store of it. And just like vitamin A, excess vitamin E can result in hair loss if you take too much of it, by triggering telogen effluvium. In a healthy person, about 10 to 15% of the hairs on your head are sitting in a resting phase, just waiting to be triggered to start growing. In other words, roughly 85% of the hairs on your head are already in the growing phase, which is exactly what you want. But if you put your body into a state of telogen effluvium, then that 10 to 15% number can jump all the way as high as 70%. This means that 7 out of 10 hairs on your head can be put into that resting phase, which triggers a lot of hair shedding. Excess vitamin E supplementation is one potential trigger for this issue. But again, this is only a concern if you take way too much. There's actually some evidence that tocotrienols, which again is a subtype of vitamin E, may be beneficial for hair growth. One study showed that taking a tocotrienol supplement for 8 months straight in patients with hair loss increased the number of hairs on their head by about 34%. So if you are somebody who wants to take advantage of vitamin E and its benefits that it can provide for hair loss, then make sure you do the following. Only use forms of vitamin E that contain tocotrienols. These forms of vitamin E have been shown to have greater antioxidant potential compared to the other form, which is tocopherols. And make sure you keep your dose at a reasonable level. It's worth noting that you will never reach toxic levels if you always get your vitamin E from food sources. You'll only need to worry about potentially reaching these toxic thresholds if you are using supplements. But as long as your dose of vitamin E from supplements is less than 1,000 milligrams per day, you don't need to worry about it. And lastly, you may experience hair loss from excess vitamin D use. Yes, it's true that vitamin D is absolutely necessary for hair growth, but it's also just as true that excess vitamin D may trigger hair loss. But just looking at the numbers, it's far more likely that you don't have enough vitamin D in your body as opposed to taking too much. And this is a big problem because vitamin D is very important for hair growth. Having enough vitamin D is necessary for pushing your hair follicles into the growth phase of the hair cycle. Low vitamin D levels have also been associated with an increased risk of the autoimmune hair loss condition known as alopecia areata, as well as telogen effluvium. And with an estimated 42% of adults being vitamin D deficient, it makes a whole lot of sense to supplement with vitamin D if you are experiencing hair loss. With all of this in mind, is hair loss from vitamin D toxicity something that you need to worry about? Probably not. The reason is that the standard dosing of vitamin D3 is usually somewhere between 1,000 all the way up to 10,000 IUs. And even though this dosing is higher than the RDA, which is set at around 600 to 800 IUs, it's still usually not enough to cause excess. But anyone who has ever recommended vitamin D3 to a patient with low vitamin D levels knows that taking 600 to 800 IUs is probably not going to do much to the vitamin D level. And this is why most practitioners recommend levels that are much higher, somewhere between 1,000 and 10,000 IUs, like I mentioned previously. But even continually taking 10,000 IUs of vitamin D3 each and every day is probably not going to trigger hair loss. You need to get into the mega dosing range that some practitioners recommend for autoimmune diseases, and these doses can be as high as 50,000 to 100,000 IUs taken daily. I would definitely recommend staying away from these ultra high doses if you are somebody suffering from hair loss, as it might make the problem worse. If you're somebody who has been struggling with hair loss and you can't seem to figure out what's causing the problem, I would recommend checking out your thyroid. And you can learn how to properly assess and check for your thyroid by checking this video out next.